one of the minimally invasive procedures that I've kind of pioneered in the area here locally. It's been out for a number of years across the country, but there's really not a large number of us spine surgeons that are doing this procedure at this point, is minimally invasive endoscopic discectomies. And when I say minimally invasive, I mean through about a 7 or 8 millimeter incision. So really Band-Aid type surgery. What this is used for, when I started doing this back 6 or 7 years ago, was mainly for disc herniations. Over the years since I initially started doing endoscopic discectomies, things have evolved. Recently, I've gone to Germany and learned newer approaches using the same endoscope as I've used in the past, just a little bit shorter scope than we used 6 or 7 years ago, but it's allowed me to do techniques that I wasn't able to do in the past as well with a longer scope. So I'm actually able to do midline discs, which are disc herniations that are central disc herniations. I'm able to do posterior lateral, which is disc herniations that come off to the side, further lateral work within the disc, and more recently with some of the newer devices to shave down the bone, I'm actually able to do foraminotomies, which is open up the space for the nerve roots with little tiny shavers to try and give people more relief of what we call stenotic symptoms, where they have significant difficulty with leg pain or pain with standing and walking activities. So using these arthroscopes, it's similar to doing a knee arthroscopy or a shoulder arthroscopy, only now we're able to put these scopes within the disc, within the foramen where the nerve roots come out, or even into the epidural space to get herniated discs from within the epidural space. So it's new. It's a newer technique for myself. It's an exciting technique. I've recently returned from Germany to learn approach from one of the world-renowned surgeons, Dr. Rutten over there. I also have trained with Anthony Young, who pretty much has pioneered and is the person that's known for this procedure in the United States, as well as David Casper, who also has done endoscopic procedures through the years. So this is a very exciting time to be a spine surgeon, essentially, because the procedures that have been around like this from a shoulder, elbow, hip, knee standpoint are just starting to hit more consistently in the spine world, but there's still very few of us doing it across the country. So this is a nice addition to what I have been able to do in the past, but it takes me even further in what will be able to do in the future. This type of a procedure is typically done under more local sedation and what we call MAC sedation, where you're just getting a little IV medication and we're doing numbing medicine in your back, and you're actually awake for the procedure. Instead of putting somebody under general anesthesia, we can do this relatively awake. Other procedures that I can do through this scope is what are called endoscopic rhizotomies. So for patients that have back pain without leg pain, or even patients with back and leg pain, we can do a combined procedure for these, where I'm going in with this scope, and similar to what the pain physicians do with rhizotomy procedures or radiofrequency ablation procedures, as we call them, I'm able to do through a scope. And the advantage of that is I can actually see the nerve and ablate the nerve rather than just doing a thermally heating the nerve up to try and deaden the nerve. Typically, your standard radiofrequency procedure lasts anywhere from 6 to 12 months. A real good one may last longer than a year. With an endoscopic rhizotomy procedure, we can get upwards of 2.5 or more years of relief with it. So we're able to give the patients with a surgical pain management technique better results than what I can even give them with a minimally invasive interventional technique, which helps out the patient tremendously. I'm also able to combine procedures in patients that have typically been fusion candidates, where they need screws and rods and bone graft to stabilize a level. And a number of patients I've been able to go in, treat the leg pain with either a foraminotomy, freeing up the nerve, or taking a portion of disc out through the scope, but also doing a ablation of the nerve going to the facet joints to help treat the back back pain. So I've saved a number of patients from having to have a fusion procedure done by doing these surgical interventional procedures.